What's up, everyone? Eder Garavito here, founder of Scholarnetics 360 and co-host of the Healthcare Education Transformation podcast. I have a really cool and amazing guest today, Dr. Jaime Gonzalez. He's got an incredible background that I can't wait to share with you. He is a graduate of the U.S. Army Baylor University Masters in PT program and also did the transitional DPT program. He is currently pursuing a PhD in higher education and leadership. What's also great, something that really intrigues me, is that he has a history of 21 years of working in the US Army, both as a combat medic and a PT. Right now, his position, he is a clinical associate professor and a director of clinical education at the University of Texas Rio Grande Valley Developing Program. The other great thing about Jaime is that he also has a lot of entrepreneurial dreams and endeavors. He has owned businesses. He has several of his own that I can't wait to learn more about. He is certified in orthopedics, sports, primary care, and direct access PT. And look at this. His research focuses are on shoulder rehab, long COVID rehab, and diversity and inclusion. So if you see his name out there, now you're going to be able to put hopefully a little bit of more information on there. Jaime, welcome. How you doing, brother?
I'm doing great. Thank you so much for having me. I've been really looking forward to our conversation.
Oh, likewise. So I give a really brief background of yourself, but you know, give us a little bit more. Like, who is Dr. Jaime Gonzalez?
Yeah, thanks. I would say first and foremost, if you'll pardon the personal info, first and foremost, I'm a father and a husband. My wife and I have been together for, my God, 30 years. And wow, that sounds strange saying that out loud. 30
It's
years. Yeah.
I'm going on 8. I'm gonna have to pick your brain on the secret to a happy marriage sometime.
And we have four children, including three adult children. Our last one in the home is 16. He's an incoming junior in high school, and we have one granddaughter. So that really is first and foremost who I am. Professionally, I mean, I think you laid it out. I was retired from the U.S. Army. I was a medic and a PT. And since then, most of the time since then, I've been in academia. I've been in higher ed for a little bit over 10 years.
I love it. And no, I'm thank you for sharing your background because I think sometimes we sort of get lost with all of our professional lives,
Oh, for sure, for
right? And
sure.
it's just like
Yeah,
so humbling and so human and it humanizes us to just like who are you? And yeah, I mean I love that you have that family. And yes, off
yeah,
the record at some point I'm gonna pick your brain about how to keep a happy marriage. My marriage is
yeah,
good,
yeah,
but
yeah.
30
I don't
years,
know if I have the secret, but yeah, I'm happy to
you
talk
have
about
something. You have something in that
it.
recipe. So, tell us, Jaime, share us a little bit about your journey as being a combat medic and then becoming a PT and eventually transitioning into academia. Like, what does that look like?
Yeah, so I mean, I mean, I think we all have unique sort of pathways. Even folks who do the quote unquote traditional or typical thing, 4 years of college and then right to PT school, and now you're a PT. I mean, everybody's different, right? So everybody has their own pathway. For me, I don't say this with any sort of, I really say this just objectively. I don't want to come off like, woe is me or anybody owes me anything. Not at all. But I grew up, in relative poverty anyway. And so when I was getting close to graduating from high school, I genuinely believed that the only option for me was the military. My parents couldn't afford college. I knew nothing about scholarships or grants or anything like that. I didn't know what the FAFSA was or whatever it was called then. So I enlisted the summer between my junior and senior year of high school. And I remember I always wanted to be I was always interested in being a PT. The original plan was medical school. I had these dreams of I was just having this conversation with my son actually, of becoming a pediatric neuro-oncologist. I wanted to be a kid's cancer doctor. But again, fast forward to 17, 16, 17, 18 years old, I said, no, you know what? I don't know how I'm going to do that. So the only thing I see is the military. And I happened to go in to speak to an Army recruiter, and Army recruiters, and I know because I did this for 3 years, Army recruiters are, and again, I don't say this with any, indictment or any negativity. They're salespeople. that's what it is. Maybe people don't like to look at it that way, but that's what it is. It's sales. And he was very, very, very good at his job, taking this then 16 or 17-year-old, relatively, vulnerable, I would say, and convincing him that there was a place for him. And so I enlisted in the military. Um, uh, at that point, I knew I wanted to do something in medicine, and so thank God I was able to do the combat medic thing. And then by that point, I'd really kind of gone back to I used to hang out with our athletic trainer in high school a lot. So PT was always in my head. And so I went to it's funny. I was in basic training at Fort Sill, Oklahoma in my God, 1991. And and I faked an injury or faked a sickness or an illness or whatever so I could go to the clinic, so I could go to the hospital. And so I made my way up there, under not great terms, as a result of lying to them and telling them I was sick. And I found the PT clinic. And to this day, man, I wish I could remember who it was. I don't remember who it was. I don't remember the name, but I asked the receptionist to if there was anybody, a PT, like a Army PT, that I could speak with, and this very kind first lieutenant, I think they were, came out and talked to me for, man, for a good, I don't know, 10 or 15 minutes. And I mean, you've been in a clinic, I've been in a clinic. It's busy. You don't have a lot of time, and here's this Army officer, young Army officer talking to this very, very young Army private. I had literally no rank, nothing on my shoulders. I'm the lowest rank possible. And they shared with me, they said, "Oh yeah, this is how I did it." And they told me about Army Baylor. And I'm like, "Really? You did?" And so from that point forward, I started working on my, working on college, working on getting my degree and getting my prerequisites. And several years later, I got in and graduated in '02 from the Army Baylor program. So it's been good. The remainder of my military time was as a PT. I will say when I retired in 2012, time flies, holy cow. But when I retired, I always wanted to teach. I had even as a combat medic, I loved teaching. I loved training young medics. And so I always felt like that was something I wanted to do after I retired. But with very few exceptions, I had only ever practiced in the military setting. And obviously the students in our PT programs, very, very tiny number of them might go on to the military. And so I didn't feel right trying to go teach when I had never really worked as a quote unquote civilian PT. So I did that for a couple of years intentionally. And it was, man, talk about a learning opportunity. It was incredible in all sorts of ways. I mean, the systems, the environments, the settings are just so different. And so I'm glad I did that. I'm glad I did that, because I think I had at least a little bit of a context of the civilian PT kind of environment and setting, and private practice and kind of what that looks like, before I went on to academia. And so, like I said, I've been in higher ed for a little over 10 years, and this is the third program, the third institution that I'm at. The first two were private, not for profits. The first one was a faith-based institution. This is the first public institution that I've been at.
Man, thank you for sharing all that. If any listeners are not humbled by your story or impressed, they're wrong. Let's just put it that way. Everybody has a story, and I think it's part of our
For sure.
job as human beings to find out their stories, right? And there's so much just to unpack in what you said, but man, you got me just like over here drooling about a lot of things that I want to tap into. But check this out. This is not an interview about me, Jaime. You don't want to know how I became a PT? I busted my ACL and I ended up in PT school. That's
Yeah,
my
there you go.
story, right?
Yeah,
And it's
yeah, yeah.
so dang boring, but I'm proud of my career and I'm proud of what I've
Of
done.
course, of
But I
course.
think that like all of those experiences that you've just shared with us not only shaped you to be who you are today, shaped you to be a great, individual and a great clinician, but also a great educator. And it gave you those experiences gave you the certain characteristics that just make you into a great educator that can connect with so many different people, right? So You mentioned you've been in poverty, so you can connect with students that have a background like that. You've mentioned that you've
Mhm.
been, well, you told you've been in the army. You can connect with students that have that background, and I think
Yeah.
it's just so powerful. And man, I love all of that. So, so tell us, you mentioned that you spent a little bit of time working as a civilian PT, just
Mhm.
to kind of get a taste of what that looked like. One
Mhm.
of my neighbors, he was in the army. He's now retired from the army as well, and he's a physician assistant. And
Oh, cool.
through conversation with him, he's a good friend of mine. We were talking, and he was just mentioning how difficult the transition from that life into civilian life was for him.
Yeah. Yeah.
So, how was that transition for you?
Yeah, it was. I'm glad you brought that up. It was difficult. It was honestly, it was more difficult than I thought it was going to be. I mean, it was fine. I'm not saying that I was losing sleep over it, but it was more bumpy than I anticipated. My entire 20 years in the military, I very much, and this kind of goes for everything. I very much saw myself having a little bit of a different perspective than sort of the typical, not better, not worse, just different. And I've always had this either strength or weakness, depending on how you look at it, for questioning authority, and for kind of challenging folks that are in charge. And I hope I do it professionally and respectfully and all that. Um, but that said, I really believe there's probably some level of ego involved too. I really believe that I wasn't going to have as tough of a time as a lot of my my veteran colleagues did when they got out or when they retired. But I did. It was difficult. It was, the biggest thing was just, and I think this part of it is personality, of course, but certainly 20 years in an institution will help shape your personality, particularly when you started that journey having just turned 18. Um, there's a matter of factness that the military, I think, breeds. There's a sort of, get to the point, sort of outlook, or style. And I very quickly learned that that doesn't fly on, in the civilian world. Like, you can't tell, and believe me, I don't want to come off like I was some drill sergeant, yelling at the receptionist in my clinic or anything like that. Not at all. But there was a certain level of adjustment that I had to make to my approach, right, and to my sort of leadership and management approach that I had gotten accustomed to in the military. I needed to make some changes, now that I wasn't in the military anymore. And that was a little bit rockier than I anticipated, and took and has taken and continues to take a little bit more work than I thought it would take.
And you mentioned that you challenged the norm a little bit and respectfully. My wife will listen to this and she'll tell you this. She's like, she thinks I'm so obnoxious because I challenge things as well. And that's why this podcast exists. We need to start
Yeah,
challenging things more.
yeah,
Now, you and I both know, hopefully, I think, there's a good way or a respectful way and a poor way to challenge things,
for
but
sure.
things need to be challenged more.
Yeah,
We are too comfortable in higher in healthcare and higher education, and we're too comfortable in healthcare.
yeah,
And thank you for sharing, those trials that you went through
of
as you
course.
transitioned into civilian life. Again, I think that just really gives you even more of an edge over people that haven't lived that because you've had those
Yeah,
experiences. But
right.
yelling at receptionists aside, so right?
Not yelling at receptionists, but I
Correction,
get your
not
point.
yelling at receptionists aside, right? In that transition and your military experience, how did that shape your approach to actual patient care? And did you have difficulty with that?
Oh yeah, yeah. That's a great question. There were also, I mainly focused on kind of the leadership and management aspect, but there were differences in my approach to patient care too. There were. I'll tell you, and I'm embarrassed about this. This was absolutely ridiculous of me to do this, but As a couple of examples in the military, I was at one clinic where one of the other PTs there, in fact, it was the PT in charge, had a little jar, and it was a trainee clinic, so we saw almost only military trainees. They had a jar of I think it was a jar of glitter or something, and the label on the jar was fairy dust. And so the joke was, and I was absolutely a part of that too. Trainee would come in, and we perceived them as being whiny about whatever was hurting. Maybe they were just doing what I was doing and faking an injury so they could get a little break or whatever. But we would kind of open that jar up and throw some glitter in the air, almost in a mocking way. And again, part of this is cultural, but obviously that's all sorts of wrong. There was another jar that he had with just straws, and the label on there was, I think, "Suck it up, Buttercup." Um, in one of my clinics, I had written on the wall. We had a dry erase. Like the entire walls were dry erase. That was weird, but I wrote something like, "Oh, let me guess. You have a high tolerance for pain." You hear that from some patients, and I was putting that down sarcastically, sort of in a mocking way. So I think for a little while there, I didn't have the respect, and I didn't offer the dignity to our patients that I should have, that I hope I do now. And again, part of that is cultural, but I think it's a cop out to say, oh well, it was military and it was a context and it was all cultural, so I didn't do anything wrong. No, that's a cop out. That I shouldn't have done those things. I shouldn't have joined in with those things. So luckily, part of this is age too, and so whatever semblance of wisdom you get with age. And so yeah, I had to definitely, sort of soften up, I guess, my approach. I particularly in my younger years in the military, my reviews, my annual reviews, my officer evaluation reports, they were all positive in terms of my clinical practice. They were all positive in terms of my leadership. But there was always a comment that said, I remember one specifically that described my leadership style and my communication style as hard and angular. And I'll always remember that. And I remember looking at the almost almost with pride. Like I almost liked it, like it was a good thing. As I've grown up and now I'm not in the military and I retired from the military, I really look back on that and okay, well maybe that was okay, not great necessarily, but okay for the context and the military, et cetera, et cetera. But that's probably not great, now that I'm not in the military anymore. And so yeah, I've had to definitely adjust my communication style as well with the staff, of course, but including with patients, and give them, genuinely strive to form that therapeutic alliance and give them the dignity that they deserve as human beings. I mean, that's something I think that has also helped because we happen to be a Catholic family, from the cradle, Catholic, and one of the things that I love about our faith, which is not certainly not exclusive to our faith, or to Christianity in general, but is the primacy of human dignity, and so I like to think I always had that top of mind even in the military, but I think the way I approached things probably wasn't the best, and so I definitely had to adjust that. Now, again, that said, you and I both know that there are certainly instances and patients and personalities and contexts that need some of that
Oh, sure.
push,
Absolutely.
and challenging them. So I certainly don't want to pretend like it's kid gloves all the time. No,
It's all about
sometimes
reading the room.
absolutely. You took the words right out of my mouth. It's reading the room. Exactly right. It's
Yeah,
it's learning how
it's
to
reading
do
the
that.
room, man. And some people just really have a hard time with that.
For
And
sure. For
and
sure.
and I think it's such a great skill. So thank you for sharing that, and thanks for being vulnerable. And if anybody's even remotely judging you for what you shared, like they need to just kind of they I hope that they get the big part of that story is like
Yeah,
you now know how to read the room and you know how to respond and react because of
sure.
your past
Yeah,
experiences.
yeah.
So, with all that you shared, do you remember perhaps a transitional moment or account that just sort of clicked you and were like, oh, like this is wrong. Like I need to start treating patients, for lack of more further explanation, better, differently.
Yeah, I probably a couple. There was I'll give you two quick examples. There was a young woman who was in a terrible car accident, and so I was working with her. She had, man, all sorts of injuries, including a mild TBI. And she was a spouse of a service member, so she wasn't herself in the military. And we had a great rapport. But in one of the visits, she made a comment, a sort of half joking comment saying, "Hey, I'm not in the military. I'm not one of your junior enlisted soldiers." And that kind of stopped me in my tracks, even though she was kind of saying it half jokingly. There was definitely a part of that was serious.
And you've never
Um,
forgotten that.
no, no, I can picture her. She Well, the other reason why I remember is years later, my first couple of years after I retired, um, she sent me the sweetest email. It almost brought me to tears. The way she articulated how much the work that I did with her, positively impacted her. And I mean, she just went on and on, and hell, I'm almost in tears just thinking about it. Anyway, so that's one. The other one is actually, I had retired. This is my first, probably my third year after retirement, my first or second year in academia. And one of the students that I tend to form pretty close bonds with our students. One of the students, toward the end of their program, we were just in my office, just sort of reminiscing as they were getting ready to graduate. And I said something like, "Hey, I'm really glad that we've gotten close, and that, please, if there's ever anything that I can do for you, et cetera, et cetera." And then I said, "But, I wish we had been this close like the whole time, but like, I don't think you said a word to me for like the first 2 years." This is me telling the student that, and the student responded with, "Dr. G, I was scared, crapless of you. Most of us are." And I'm like, "What? What are you talking about?" And so, she went on to say about how sort of intimidating, some people perceive me to be, because of my uh hard and angular communication style. And so I remember, I was at their wedding, for God's sake. So we're good friends now. And we had gotten to be, by that point, we had gotten to be really quite close. But that was, again, as you said, I don't think I was nearly as good at reading the room, or maybe not even not good at reading the room, but not good at taking those cues that I do pick up on, and making the adjustments, necessary to accommodate those cues.
Yeah, and once
So
again, you remember this experience like yesterday.
exactly. Oh, absolutely. Yeah,
You know
absolutely.
what's lovely about that experience, and I'm gonna geek out here just for a second with learning
Mhm.
theory that I'm sure you're gonna hopefully
Yeah,
pick up on, right?
yeah, yeah.
That is like literally a prime example of good old Banduras, right?
Right.
Social
For
learning,
sure.
cognitive theory, where we're looking at the environment. You were
Yeah,
inadvertently, not on purpose,
yeah.
the environment that you were developing for your students right there was at that moment was intimidating, not
Right,
welcoming,
right.
hard. But that's
Yeah,
not what you wanted,
right,
but you
right,
didn't know it, right? I did the
right.
same thing, and I don't have your background where
Yeah,
students recently told me that half the class was scared of me. I'm like, you're
yeah,
scared of me? You
yeah,
can
yeah, yeah,
break you.
exactly.
I mean, you can break me with a straw,
Right,
but it
right.
came down to how I sort of portrayed myself and how I
Yeah,
delivered information, even though they loved my courses and I had great feedback.
right.
And as we sort of talked this through and laughed about it, it came down to the fact that I was quote unquote, and I don't even know what this really means. I was so smart. I'm like, I've been doing this for a lot
Sure.
longer than you have.
Yeah, yeah, yeah.
But at the same time, I had to just sort of reshape my environment to
Hmm.
make it more welcoming, right? To make the
Of
environment for
course.
my students more comfortable for them to make mistakes, to ask questions. So
Right.
this student literally wanted to hang out with you and learn from you and pick your
Yeah.
brain for 3 years, but they
Right.
just didn't feel comfortable. And how did you adjust to that? Like, what adjustments did you make? I'm sorry.
Yeah, I'll tell you. I think a lot of reflection, for sure, and a lot of, just talking to folks, especially in those first few years of being in higher ed, is how do you do what you do, and going to the person that is getting course after course, superb course evaluations, and I'm like, okay, well, yeah, I get. Obviously, part of it is your teaching style, and I want to hear about that, but like what's deeper, like how do you connect with the students, how do you get them to engage, and for my part I've found that allowing myself to be vulnerable, being honest and upfront with them, and giving lots of grace, again still holding them to the standard, kind of similar to what I said with patience, right? Like it's not all kid gloves, right? Sometimes you gotta take the kid gloves off, and you have to have a come to Jesus moment, and that's okay. But I've learned how to cultivate those relationships from the outset, so that when those, difficult, challenging conversations are necessary, you can have them, and they feel comfortable and safe and secure and brave enough, in front of you and around you to, for themselves to be vulnerable and listen and have that what's the preferred term, crucial conversation, I guess, about whatever it is that we need to have a sit down about, so that took me a little while to hone, and again I think part of it is just life experience, and again whatever semblance of wisdom comes with age, and certainly my faith tradition has a lot to do with that. My family has to do a lot to do with that. My children, as they've grown up, we're a very close family, and we are all to a fault honest with each other, and they, as they've grown up and gotten comfortable, and we have a different relationship than we did when they were 10 and 14 and 18 and 20. um they're able to, in a very loving, in a very loving, positive manner, they can tell me like, yeah, when you did this as a father, that made me feel like, this small, even though that was anything but my intent. And so I've learned a ton from them too. And again, I'm not making the direct analogy that teaching, is like being a parent, but I think you would agree
Oh
there
yeah.
are, it's a Venn diagram, right?
Yeah,
There are
absolutely.
overlaps. Yeah,
Yeah, 100%. I mean, at the end of the day, the secret for anybody to really make progress in any way, shape, or form is to get started somewhere, right?
absolutely.
And
Yeah.
so, like, to sort of summarize what I've heard, man, and please correct me if I'm wrong or change my adjectives here. You started as somebody potentially that was somewhat lost with limited resources. Then you became somebody who was hard because you felt like you needed to survive in an environment. And now you're somebody who's humble and vulnerable.
Yeah, I don't think that that's unfair at all. I think that, the other piece to that, and this could be a whole a whole different episode, but the other piece to that, is I did, and some of this definitely comes from therapy too, and that's been very helpful over the years. But there was a chip on my shoulder. There was a chip on my shoulder from, looking back, maybe as a 18, 19, 20, early 20-year old, looking back on my upbringing and like, well, I didn't have this and I didn't have that and I was poor, and maybe there was even, though I hate to admit this, maybe there was even a little bit of that victim mentality that was a part of that chip on my shoulder. I don't think it was a large piece of it, or at least I don't want to admit if it was. But there was a chip on my shoulder about, why didn't I have this when other people did? Why was I, I could give you example after example after example of being racially profiled. The first time that and I did say first time, the first time that somebody had a gun pointed at me was a pair of border patrol agents. I was just walking up the frontage road to go have lunch with my mom, from my job at the car wash, and they ended up being like my regular bullies that I could count on, just stopping me and harassing me for no reason that summer. And so all of those things and similar things I think did yield, something of a chip on my shoulder, which then, contributed to that, at least part of that hard and angular approach toward folks. But, life and experience and therapy and my children, my family, and my students, I really, really give them a ton of credit
So we learned so much
for
from them.
edifying me and for making me a better, not only a better teacher, a better academician, but just a better person, a better man. I mentioned my faith tradition. I have a sort of a special affinity for Ignatian spirituality or Jesuit spirituality. And their big thing is, you'll see this motto a lot on Jesuit campuses, on the campuses of Jesuit universities, is being, the original is of course with our patriarchal society. The original is to be a man for others. Now that has been progressed to be a person for others. And I think about that every single day. And I think I have that on a couple of my social media kind of profiles, like, this is who I am. I strive perpetually, and fail, to be a man for others. So that's been a big part of my, hopefully, growth.
Yeah, I mean, growth, man. I mean, that's what it's all about. And yeah, we learned so much from our students. Shame for any educator out there in whichever capacity they are that does not open themselves to learn from their students because they bring so much to the table. And
Absolutely.
oh gosh, not even just knowledge.
Yeah.
I was just asked a question yesterday in one of my lectures from a student that was about a specific medication and cardiac and all these
Yeah.
things, and I was
Yeah.
like, I have no idea to be honest with you,
Yeah.
but
Nice.
let's look it up. Like I just don't know, and we learn
For
together.
sure. For sure.
Um, this is also cool, and you've also grown so much that you're also a graduate of the APTA's Fellowship in Higher
Yeah.
Education Leadership,
Mhm.
right? And in the beginning of our conversation, you described that someone described that your leadership was hard and angry, if I remember correctly.
Angular, hard and
Angular.
angular.
Thank you,
But
angular. I
but you
can't,
know
I can't,
what?
I can't
There
read
was
my
probably
writing.
some anger in there too. Yeah.
Yeah, potato, potato. I'm kidding.
Yeah.
So how would you well, first, how would you describe your leadership now, your leadership style now, and then
Yeah.
share a little bit about how that fellowship helped you grow even more.
Yeah, I think I would predominantly describe my leadership style as servant leadership, as drawing from the tenets of servant leadership and transformational leadership, particularly in my role in academia. I think the fellowship, first of all, was a positive experience for sure. I was able uh, to get to know and learn from, all of these, because most of the folks in the fellowship are program directors, department chairs. And so I learned a ton from them. And I think, one of the biggest things is finding a balance between, yes, maintaining boundaries, because those are important too. Maintaining boundaries between personal life and professional life, maintaining boundaries with students and with your staff or your faculty colleagues. But again, finding a balance between doing that and being vulnerable, between maintaining boundaries and letting go a little bit, and letting yourself be known maybe a little bit more than you normally would feel comfortable doing. And there was a couple of folks in the fellowship, specifically, that I had wonderful conversations with about exactly that. So that, I would say that, and just the networking piece, right, with all the folks that you meet. We have a group me, kind of group chat, and with our small group that actually Kim was one of the mentors for. Um, and I can just get on there and reach out to these, whatever it was, folks around the country with a particular question, particularly as we're going through our AFC. So it's a wonderful resource. The one thing you didn't ask about this, but I'll mention it because we're talking about the fellowship. The one thing that I do wish they would have talked more about, and this is again from experience. We talked a lot about in the fellowship. Again, most of the folks are program directors. They talked a lot about leading and managing faculty, particularly quote unquote problem faculty or challenging faculty. And I wish they had also talked about how you lead up and how you manage up when you have a department chair or a dean or a associate dean or a provost or whatever the higher up is, when 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 you're having to manage them and lead them. You know what I mean? What if they're a big problem? What if their leadership style is poor?
So there's not a lot like how to manage leaders
Yeah, exactly. So
or how
I
to
wish there
interact
would
with
have been more
leaders.
of that. Yeah.
Well, hey, maybe that's part that you can grow
Mhm.
and contribute to the fellowship,
Yeah, definitely.
and or something you can build yourself because you found that gap. I haven't
For
been
sure.
in that fellowship, but I can appreciate that. Uh, yeah, it's all about growth, man, and I love it. I want
Yeah.
to tap into something a little bit different, if that's all right with you. I'm
Yeah.
really interested by one of your research interests, Abide,
Mm.
right? Which is anti-racism, belonging, inclusion, diversity, and equity. Now, I think we can agree that even though it's been way too late, up until the recent years is when we really started focusing more on DEI within
Yeah.
educational context, work, everything, right? This should have
Yeah.
been like decades ago, but we can't go back in time, right? So we can just kind of at least move forward. But I also feel that there are a lot of institutions, whether they're academic or healthcare or just restaurants, doesn't matter,
Mhm.
that use DEI as buzzwords just to kind
Yeah.
of put something out there.
Mhm.
Oh, we have like one person of color, so now we have
Yeah.
diversity, right?
Sure. Sure.
And unfortunately, that also happens in higher education. It happens in PT education. It's
Mhm.
happening right now.
Mhm.
So to get to my question, really, with this growing emphasis in DEI in and your research interest, how do you ensure that these values are genuinely integrated into your practice and your teaching as opposed to just them being buzzwords?
Yeah. It can be a challenging endeavor, particularly now that we've started to go in the opposite direction. When George Floyd was murdered in May of 2020, that for whatever reason that was a seminal moment in our nation's, and I put this definitely in quotes, awakening to the reality of systemic inequities, systemic racism. Um, that summer, I remember having a conversation with a dear friend of mine, uh, who shares a different, a different political ideology than me. And they were lamenting, and I was celebrating the various corporations, institutions, universities that were coming out with their purported support for all things DEI and anti-racism. And we don't, our culture is not, we have nothing, racism has no place in our culture, blah blah blah. And I remember sitting there, on the one hand celebrating it and being happy about it, but on the other hand, as a realist, I am a very hopeful person for sure, but I'm also a realist and a pragmatist. I was also saying two main concerns. One is that some component of these people's stated concern with DEI and racism is performative, and that is probably not a small amount. It's probably a pretty big amount of all of the concern and regard for anti-racism and DEI stuff. a good chunk of that is all performative. As you said, it's all, window dressing. And so that bums me out. The other thing that I was concerned about, and I wouldn't even say concerned. I was just being real, is I told my friend something like, well, hey man, I know you don't like all this stuff, but don't worry, it's not going to last very long. I will give it 3 years max, before you start seeing places kind of back off from DEI stuff, and you'll probably start seeing it legislated, and you'll see, predominantly, you'll see, well, not predominantly, exclusively, red states, using the legislative process to turn the wheels back. And here we are in 2024, and that's exactly what's happening. And so, it's a little bit of a sensitive issue with me and my new position. I am at a state school in Texas that just last year, or I just went into effect January of this year, SB 17, if I remember right. That's one prime example of that, where they are and have outlawed, all things DEI, or certainly many things DEI. And so it's hard for me, to kind of toe that line of being true to myself and to my values, but also being compliant with a law. I mean, it is however much I may disagree with the law, it's the law. And so that's hard. I just yesterday actually completed, some compliance training for this law, with our institution. And I was really bummed the whole time I was doing that training, but I mean, I had to do it. So I think ultimately it's being true to myself, and again, being vulnerable with students, and giving them, example after example about how I perceive these things apply to patient care. And giving them the data, in support of those things. And look, these are smart people. They can come up with their own judgments and their own kind of way of doing things, based upon that. So I mean, I would say the bottom line for me is I stay true to who I am, and I'm very honest with students, and I do that because honestly, I have always felt, and this has come back and bitten me, more than a few occasions, but I have genuinely always felt that if I am if I am having to spin something, to the point where it's basically lying to you, like that's, to me, the ultimate disrespect. um
Absolutely.
yeah, and so that's why, again, man, it has bitten me and will bite me again, I am sure. But I have always maintained that I have to be honest with
Just
you,
and
that
stay true to yourself. Yeah.
yeah, I like you, I respect you, primacy of human dignity, et cetera, et cetera. Why would I be anything else other than honest with you? Now, that said, I believe me, I recognize that, just because you perceive something to be true doesn't necessarily mean that it has to be said. Yeah, I get that. But at the same time, if it's something that I'm holding back that I think could benefit somebody, that to me is like I'm
Yeah.
lying to them.
Absolutely.
Yeah,
And
yeah. So
I have one regret about asking you this question. I can go into it for so long with you,
yeah,
and I want
right.
to,
For
right? And so
sure.
like I think, I'm like I should have just saved that for a different episode, and
That's funny.
we might do that and plan that
Yeah,
out
yeah,
because I think there's a lot to unpack there.
yeah.
Just still like making sure that you say, like you say, true to yourself. But what I really liked about what you said, I mean, I liked a lot of things about what you said, is that we teach things to students that they don't believe in. One of them, I don't know, maybe histology or something.
Yeah,
They're like, why am I
totally.
learning this?
Yeah,
Why
yeah.
am I wasting my money? But if you tie it, just like you said, like give them real life examples of how it ties into patient care,
Absolutely.
you're selling it, they're buying it.
Absolutely.
And there are things that we have to sometimes introduce in class, not even DEI things that are
Yeah, yeah,
controversial.
yeah.
And we have to do so in a way where we tie it into patient care to sell it because we're literally sometimes like salespeople. right?
Yeah. Yeah.
And so I appreciate that. I'm gonna unpack that question with you at a different time,
Yeah. 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 No
because
problem.
I think it needs to
It's a
be
lot.
done.
Yeah,
It's a
for
lot.
sure. Hmm.
I got two more questions for you,
Hmm.
just in brief.
Yeah.
So what advice would you give physical therapy students and or new graduates who have an interest in pursuing a career in academia?
Yeah. I'd say a couple of things. I think one truly is the networking piece. And part of me hates that this is the case. I think you've heard me say that a couple of times. Part of me hates that this is the reality, but it is. It is a reality. Is getting out there and meeting people, and that's part of the reason why I don't like that is because I am by nature an introvert. And the other part has to do with how some of these kind of potentially tie into inequities and systemic
Sure, sure, sure,
issues
sure.
and whatnot.
But it's
But
still important
it
for
absolutely,
pursuing a career
yeah,
in academia.
it
Yeah,
absolutely is. And the other thing along with that I would say, if somebody is very serious about it, is make yourself useful. Like when you meet somebody, don't just say, hey, this is me. I love your work. So nice to meet you. No, like do your homework on them. Does the things that they do interest you? Their, research agendas, for example. And if it is, then come up with a way that you can potentially be of use. And
absolutely,
people for the most part, there are definitely exceptions like with everything, but people for the most part are in our profession I've found to be nice and approachable, and they'll sit there and listen to you, and you'd be surprised at how much of an in you can get if you just take the time and approach
absolutely.
somebody and talk to them.
Yeah, that's great
So don't
advice.
be afraid of doing that.
Yeah, no, I love that. That's great advice. And yeah, in my place, introverts in a little bit of a disadvantage, but hopefully with our virtual world, and perhaps with a screen in front of them, it sort of buffers that.
Yeah.
But I think in
Yeah.
summary, what you mentioned about networking and it being important is that it's not just about getting business cards, right? You
Yeah.
network, you meet people, but as the one who is networking, you also want to always offer something to them as well.
Absolutely, you do. Yeah, no,
Always,
absolutely. Yeah.
always, not just, hey, here's my number, call me later kind of thing,
Right,
right?
right, right,
Yeah,
right.
exactly. So no,
Exactly
I love
right.
that. It's great, great advice. And fortunately or unfortunately, call it what we want to call it in our profession, networking is literally the catalyst to a great career,
Yeah,
you know.
yeah.
And yeah, no, thanks for sharing that. Jaime, if you were to think of one thing that you would change about physical therapy education, what would it be?
Um, we have we don't have enough time. And I'm sure everybody is listening to this is probably saying, yeah, this will take another, multi-day podcast to unpack. That one thing, I think I would focus on. I'll still count this as one thing. One, I think we have placed a hyper focus on efficiency and return on investment, and those things are important. I'm not sitting here saying that they're not. They absolutely are. That's obviously in large part, tied to the student debt crisis, the student debt issue. Yes, those things need to be addressed. But I think that as happens with so many issues, maybe the pendulum is starting. We're starting to recognize that the pendulum maybe has swung a little bit too far in the opposite direction. And I'm not just talking about length of program. That is a component of it, but I'm also talking about, and this is you could apply this more broadly to higher education, in
Absolutely.
whole, is an opinion that the humanities are worthless, that you can't get a job with a degree in art appreciation or whatever it is. And again, I think the pendulum has kind of swung too far to the other side, where we are in a territory that I think is a little bit dangerous in producing potentially physical therapists who, in spite of the progress that we've made, who may end up being a little bit overly biased, on what I forget his name, what a German philosopher called calculative thinking versus meditative thinking. Um, and I know we talk a lot about the therapeutic alliance and how social determinants of health, kind of might impact a person's health and well-being. And we touched on DEI stuff, but I think higher ed, including PT, including academic physical therapy, has taken I think undue criticism from folks both within and outside of our profession in the public for focusing too much on social issues, for not paying attention to things that really pay the bill, as some people put it. And I think the humanities, and I hesitate to use that word because that to some people is like a bad word, is like a four-letter word. But I think there's been traditionally, and I see it kind of coming back around, just like we talked about with the DEI stuff. I think there's traditionally been, and I think it's happening again, a an over emphasis on things that are quantitative and things that are measurable and things that are, quote unquote, real science. And there's a big problem with that. And not only is there a big problem with that, from a sort of values perspective, where you risk ignoring the individual, in some way diminish the individual's
Right.
dignity.
Yeah. Yeah.
But I think there is really like a potential a detriment to one's clinical reasoning skills, critical thinking skills, clinical decision making skills, when you do overemphasize and hyper focus on the quantitative, and you ignore and you neglect the qualitative. You
Got
ignore
it.
the individual, you ignore their context, you ignore, and so I see that the public, and certainly a particular segment of the population has really come after higher ed as the devil incarnate, and producing nothing but bleeding heart, liberal, woke, extreme citizens. That's dumb. I mean, that's not
Yeah.
happening. First of all, that's a stupid assertion to make. Now, that said, I'm almost done, I promise. That said, that's not to say that higher ed or academic PT are perfect and that we don't have improvements to make. No, I am definitely not saying that we have definitely painted ourselves into a corner in a lot of different ways. But I think, again, I think broadly the pendulum has started to swing too far to the other side,
Sure.
where it's going to start impacting learning, and it's going to start impacting student physical therapists and novice physical therapists thinking skills. I mean, truly, thinking
Yeah.
and feeling skills, I would say.
Yeah, I mean, as somebody who, admittedly, not too long ago, just started appreciating qualitative research, I can resonate with
Mhm.
that. So, I appreciate that,
Yeah.
man. We'll hyphenate that answer. How about that?
There you go.
But thanks for hanging out with me, Jaime. Thanks for being vulnerable, for sharing about your journey. I'm really hoping that listeners will really resonate with a lot of the things that you said, and grow and continue to grow. Because we have a lot of imposter syndrome out there, and I'm
Oh, for
hoping that
sure. Yeah.
that just really helps some of our listeners. I'll catch up with you again for another interview at some
Yeah,
point, but
definitely.
I appreciate your time, and thanks for hanging out with us.
Awesome. Thank you so much for the opportunity. I really enjoyed our conversation, and whether for a podcast or otherwise, I look forward to our next one.
Likewise, take care.
All right, take care. Bye.